Good morning, East Coast time at least, to everyone who has tuned in. I am Ruth Ann Norton. I'm the president and CEO of the Green and Healthy Homes Initiative. And we're so glad that you've joined us today for the first in a series of papers that we are going to be doing on electrification and affordability. And the evidence we're going to start with is those cases in Baltimore where we've had a little bit more longitudinal data to talk about this important issue. If you want to go to the next slide, I want to tell you a little bit about GHHI in this work. And if you go back, we can see what the agenda is going to be today. But we're going to really talk about the movement in Maryland with the leadership of an executive order from our governor, Wes Moore, why we are heading to a zero emission standard, ZHI standard, why we are advancing clean heat. And for us at the Green and Healthy Homes Initiative, this is a matter of addressing the important things for families, the rising housing costs, rising health costs, rising energy costs, and utilizing our work in healthy housing to address that. So you'll hear a little bit from our team, Jessica Prudencio, who's our Housing Intervention Director in Baltimore, Justin Barry, who's a senior, who's a director of our climate, energy, and equity work, and Wynn Tucker, who's a director in our policy and innovation team, and the work they've done to discern and decipher the data that we have on the impact for families. And then we will, of course, talk about how we're using this to shape our policy direction, things that we've learned, both that are making really positive impacts, and those things that we need to address that are barriers for families as we look to advance clean heat. And we will open it up for questions and answers from each of you. If you want to go to the next slide, a little bit about GHHI. We were founded over 33 years ago in Baltimore, originally to address the issues of childhood lead poisoning. But we learned very quickly that we can't just focus on lead poisoning, which is a critical issue and important to the DNA of our organization, but we have to think holistically about housing if we're thinking about addressing the social determinants of health, opportunity, and equity for every family. Our focus is on disadvantaged communities, vulnerable children, and seniors. And at the heart of our work, of course, is energy and energy's impact on indoor air quality, on health, on housing value and stability. So let's talk a little bit about that today and what we've learned. If you want to go to the next slide. To understand our work in addressing root causes, we're looking at those environmental factors that can either be with families in unhealthy housing, or we can work to break that link between unhealthy housing and unhealthy families and create better opportunities. So we do approach our homes in a whole house manner, addressing lead paint hazards, asthma triggers, such as poor indoor air quality caused by mold or pests or VOCs. We're also looking at good ventilation, preventing injury hazards, radon, asbestos, to address those. And then in the energy side, we're looking at weatherization, energy efficiency, and the issues of decarbonization, electrification, and solar, because we want to address the same things that we originally saw in lead in carbon emitting appliances in homes, and that is the impairment that it causes for neurological development, for reproductive development, and for long-term health. And so we look at this together in our housing rehab retrofit program for families in Baltimore and throughout the United States. If you want to go to the next slide. We do our work in a way that aligns, braids, and coordinates resources from philanthropy, from state and local government, from federal government for those dollars that are still coming to address these issues, and we're grateful that they are. in this environment. But also we look at the private sector in healthcare and utilities and other private and quasi-private sources to bring those together to address holistically those issues that cause ill health, that may undermine wealth building, housing stability, and instead to turn that to opportunities for housing stability, for intergenerational wealth transfer, for better health. And you'll see all of that built in to our affordability framework as we think about electrification. So if you want to go to the next slide. So we're transitioning in Maryland to push an agenda for zero emissions, GHHI standards, and clean heat. And let me tell you a little bit of why on that. So we have a real issue here in Maryland. 71% of our homes burn fossil fuels in furnaces, water heaters, stoves, and other building equipment. What we know is it has a terrible impact through nitric oxide, through benzene, through carbon monoxide that people are more familiar with. But benzene alone is a leading cause perpetrator for cancer, for example, that people don't think about. And all of these together have led to 163 premature deaths annually, a 24% increase in pollution exposure, especially in our communities of color, in our disadvantaged and lower wealth communities in Maryland. And we lose through that about 1.3 billion just on our health impacts. Higher emergency room visits and hospitalizations, medical expenses, wages, and impact on Medicaid, not to mention the other things that it does in housing value, in housing stability. So we have to think about all of these things when we think about our path to clean energy, which we believe will improve our economy, improve the health and opportunities for families. Let's go to the next slide. So our GHHI standard was mandated by Wes Moore, our governor, in the 2024 executive order. And the Maryland Department of the Environment is leading the effort to develop a zero emission heating equipment standard, which ensures pollution-free space and water heating systems. We recently did a webinar with Mark Stewart at MDE talking about the progress that MDE is making on clean heat and GHHI standards. But all of these standards are designed to reduce those nitric oxides, pollution, and greenhouse gas from fossil fuels appliances in homes, gas stoves, furnaces, oil boilers, propane, all of this leading to factors of ill health and actually using outdated equipment and not delivering on the indoor air quality that we should all have in our homes. So the state supports these climate goals that align there, and the agency's directive is to protect resident health by regulating local air pollution, indoor and outdoor. So if we want to move to the next slide. And then clean heat rules that are in alignment here, right, is that we have the zero emission heating standard and the clean heat standards, which all make up the package of clean heat rules for Maryland. And these are complementary policies that will enhance successful and equitable implementation. Heat pumps are already strongly utilized in Maryland. And the good news is, and you'll hear more about it, but under the Utility Relief Act, we have $72.5 million of new heat pumps coming to the market thanks to our legislature and to the Moore administration. This will be administered by the Maryland Energy Administration. And that effort, plus existing funding to improve clean energy efforts, really also are calling out for these rules and standards to come forward so that we can work together all of this and what it looks like it's going to be coming under the Homes and Heroes dollars to bring a brighter future for Maryland through clean energy. So if you want to go to the next slide. So I'm going to turn this over to Wen Tucker, and he's going to talk to you about our framework on affordability and electrification, really looking at those co-benefits as a factor, not only health, but the other economic benefits that come. So when great work on the paper, though, that you and Justin and Jessica have contributed to, and I'll turn it over to you. Thank you.
All right. Thank you, Ruth Ann. So, hi, everyone. My name is Wynn Tucker, Director of the Policy and Innovation Team at GHHI. And I'm really excited to be presenting this report to you today, presenting these case studies. What I'm going to be doing over the next few minutes is just talking through, as Ruth Ann said, this holistic framework, this kind of lens of looking at all the different dimensions of how electrification impacts affordability at the household level and things that as policymakers, advocates, program managers, and even households, just the different considerations to have in mind with this. So I'll go through this for a few minutes and then we'll pass on to my colleagues, Justin and Jessica, for case studies. Just to introduce this framework at a high level, the way we're thinking about electrification and affordability is looking at these four pillars here. So, the upfront costs on the left, equipment and installation costs. The second being utility and energy costs. So that's those sort of operational energy costs of running your appliances. The third is health benefits, and Ruth Ann touched on the numerous health benefits, and the evidence continues to build of the health benefits of switching to zero emission appliances. And then finally, there's a group of home co-benefits, including impacts to your home value, housing stability, other co-benefits. And we wanted to present this framework as such to really make sure that the health benefits and the other co-benefits are elevated. As you'll see in our case studies, those are really, from a client perspective, the households that we've supported with electrification, those tend to be the most impactful, the most significant benefits. And affordability right now at the household level is such a critical issue. But on occasion, it can be sort of narrowly looked at from the lens of, just one upfront cost or utility bills. And we have really great data on all of that, but want to make sure that the health benefits and the other co-benefits are elevated as well. So go to the next slide. I'm just going to touch on each of those different four dimensions. So to touch on the equipment and installation cost, so what we're talking about here is, the household affordability impacts of choosing a zero emission appliance instead of a, combustion appliance. And typically, we have some data in the report. It depends a lot on the area, the appliance, a number of factors. But typically, for these higher efficiency zero emission appliances, such as a heat pump or a heat pump water heater, there may be a slight cost premium upfront to households. Again, it depends a lot. That may be very, minor. It may be on the order of several $1,000s, and that's where, especially with the low-income households that GHHI focuses on, it is so critical to have the aligned braiding and coordinating of funding sources to ensure that we're delivering these services, these appliances at as little of a, not impacting that upfront affordability to households. So delivering that in our case without upfront cost. And there's a number of incentive programs and different financing options and ways that are trying to improve the upfront affordability for zero emissions appliances. We have some examples here of funding sources that, for the interest of time, I won't go all the way into, but definitely happy to take questions. And I'm sure Justin and Jessica will get more into the upfront costs. We go to the next slide. So our second kind of dimension of electrification and affordability is utility and energy costs. Now, this is obviously a very, kind of flashpoint and serious issue right now, given the rise of both electric and gas utility rates in recent years, sort of a double-digit rise in both in recent years. And there's a 2024 report finding that 1 in 4 Marylanders were unable to pay an energy bill in the previous year. We see, on both electric and gas sides, at least in the short term, further increases most likely. And so preserving energy affordability is really crucial, really critical. And there's also, as we'll get into on the next slide, concerns in the long term, especially for some the STRIDE pipeline replacement program in the Baltimore gas electric territory of further rate hikes down the road with gas utility rates. And so Justin, we go to the next slide. I will just give some considerations on the utility and energy cost. We've got some great data, so I think that's the best way to kind of delve into this story of, what are the different impacts of electrification on utility costs. I'll just say at a high level, the sort of pre-existing baseline fuel matters a lot. So much of the modeling that we've seen and have building stock analysis ourselves shows that households in Maryland that are using a delivered fuel such as oil or propane or electric resistance heating will see or should be in line. Again, it can always depend, but should be in line to see savings from transitioning to heat pumps. If a house has gas, there's definitely potential for savings, but there's also, it can be more variable, and that comes down to the utility rates of gas and electric. Heat pumps are 2 to 3 times more efficient than gas furnaces. So again, it really comes down to the rate spread. Weatherization is also critical. As Ruth Ann mentioned, GHHI delivers services in this whole house approach that integrates weatherization with electrification and other health and safety measures. And our modeling has found that when including weatherization, that really improves the savings picture for many more gas to electric homes, and we think that's a big piece of energy affordability. And as I mentioned, our modeling as well is looking at the potential future gas rates from the STRIDE infrastructure program, those potential increases that, in addition to a potential shrinking customer base as electrification continues, that the rate trajectory would favor electrification. So we'll go to the next slide. So the third dimension of our electrification affordability, how households are impacted, is the health benefits. There are, as we've discussed, a number of kind of growing research studies and just growing evidence of the health impacts of combustion appliances. So, we see better overall health and reduction in mortality, fewer trips to the hospital and urgent care. So both from, outdoor air quality improves from switching to zero emission appliances because furnaces and water heaters, they vent their emissions to the outdoors, gas furnaces and gas water heaters do. And so by switching to zero emissions appliance standards, it's a significant uh, improvement in outdoor air quality, and that's why Maryland and other regions are looking at these as air quality environmental improvement tools. And within the home as well, both from those appliances as well as gas stoves, which, as Ruth Ann mentioned, are associated with asthma, associated with benzene, and they emit directly into the home. And so overall, switching to zero emissions appliances is offers critical health benefits. So we go to the next slide, Justin. I'm going to go through these kind of quickly. I want to make sure we have plenty of time for the case studies. So just underscoring that there's significant savings to be found from switching to zero emissions appliances. And household health costs are a real concern, whether that's a medical bill, whether that's missing school, a child missing school or having to miss work. And so that's why we think it's critical to elevate and consider health alongside upfront and energy affordability. Go one more slide, Justin. Finally, we have a bucket of other home co-benefits. So there've been a few studies, including one that came out quite recently on the home value impacts of installing heat pumps. So one study finding 4 to 7% price increases and home value increases, which can mean, wealth building and just overall improving housing stability for homeowners. And then a study that came out very recently from the Smart Energy Consumer Collaborative in partnership with National Association of Realtors, also finding an increase there. Our focus of the clients we serve is single family homeowners. So it's important with this topic to also, in the context of renters, to ensure that there's tenant protections and that these increases don't negatively impact tenants. But the focus of this report and our clients is on homeowners. So I'll just mention that. And finally, these improvements allowing folks and families, especially senior citizens, to stay in their homes longer and the housing stability benefits of that. These can all, be considered part of the home co-benefits. And so as we, pass off to Justin and Jessica, I'll just, remind the four pillar framework here. We've got the equipment installation costs, utility and energy costs, the health benefits, and the home co-benefits. and encourage you to check out our report if you want to read about our background in each of these more into depth. But without further ado, Justin, Jessica, I will pass it off to you.
Thanks, Wynn, and hi, everyone. I'm Justin Berry, Director on our Climate Energy Equity team here at GHHI, joined by Jessica. You can introduce yourself real quick, Jessica.
Good morning, everyone. I'm Jessica Prudencio. I'm the Director of our Housing Intervention Services here in Baltimore.
Awesome. So we're going to walk through 4 case studies that we have really robust data from our electrification work here in Baltimore. And we wanted to do this both to illustrate how we might apply the framework that Wynn presented on a household by household level, knowing that that is how people experience electrification, and also show the early evidence about the positive benefits people are experiencing in our programs here. So, we understand we're presenting 4 case studies. It's a small sample, but hope that folks can appreciate the way that we're able to really go in depth with each one and bring the human experience to life here. And as Ruthann mentioned earlier, we hope to be able to continue to share out more as we collect more data, and hope that others will join that work too. Real quick, some background on the projects. These were all clients served in GHHI's Baltimore City program for low-income homeowners. Work was fully covered by grants at no cost to the clients. The electrification and home intervention work was completed from late 2022 to early 2024, which has given us now a few years of outcomes and conversations with these families on how it has gone. We used this whole home model that we described earlier. All the homes were identified as good electrification clients because they had older gas heating systems that were operating inefficiently, and clients were interested in participating in our electrification program. As we noted earlier, gas is a significant percent of the building stock in Maryland, the homes that use gas for their heat. So we think it's really important to dive into this. It also can be where it's most challenging to see the affordability benefits come through. The benefits are clear and consistent for electric resistance heating customers and delivered fuel customers. For gas, it can be more home dependent right now. And so that's why we wanted to really highlight what's going on with these gas customers, which often are the places where it's challenging. We got feedback on our programs from multiple rounds of conversation, interviews, and home visits over the last couple of years. And what we're presenting here is just a taste of the data and the details that we have in the report. Encourage folks to go look at the report and dive in. We've got a ton of information on the job scopes, the costs, energy usage, and the rest. And then the final note I'll flag is that each of these clients did eventually receive solar panels, but we're not including that in this analysis. Those were more recent, so we don't have the full year of data with it. We want to focus on just the home interventions before that. So this table summarizes our results from these 4 case studies, identifies clients A, B, C, and D, organized by those 4 pillars that Wynn presented on: upfront costs, the utility costs, health benefits, and the home code benefits. And very quickly, we'll go into some details for these further, but we see positive saving results with some nuance, which we're going to get into describing. And what stands out to us and in our conversations with clients is how much the health benefits and the home code benefits were important for the client's experience. Both the health benefits from the appliance electrification, but also the housing stability that came from someone coming into the home, helping them address longstanding needs and improve the conditions of the house itself. Jessica, would you like to add briefly on to that experience of how people appreciate the program?
Oh, of course. We see a lot of homes here in the city in this population that are facing some really big challenges. We have horrible roofing damage, aging in place issues that aren't being met, broken furnaces, broken boilers. And we come into the home, and with the braided funding model, we're able to eliminate so many of the health and safety hazards and allow people to stay in their homes. One of these houses had a horrible, horrible roof leak that was collapsing. Another one didn't have a functioning boiler. And it puts people at ease, and it provides them peace of mind, and it helps to keep them in their neighborhoods, stabilize the neighborhoods, and give them a positive outlook toward their future. So it's physical health, it's mental health, it's the whole 9 yards and how they feel now being in their homes.
Awesome. And so key lessons that we highlight in the report that drive our policy recommendations are that electrification can lower bills for gas heat customers in Baltimore. That's what we're seeing in our results. And it's important to recognize that as kind of a proof of concept that this can work, especially when we're doing it as a comprehensive scope of work. Second is that client education is key. We see clients where the changes to their home are significant. And so investing in that capacity to do the client education and support, I find is really helpful. That dovetails into that third recommendation that we really appreciated maintaining a long-term relationship with these clients as we met with them and talked with them about the outcomes of this program. We think that expanding on the capacity to do that within programs will be really helpful going forward. Fourth, rising utility rates are hard on all customers. These customers saw significant benefits and still felt the pressure of rising utility rates, even if their bills were going down. That pressure is significant, especially for low-income homes, and especially when weather gets really warm or really cold. Finally, the health, thermal comfort, and quality of life improvements may matter more than utility cost savings to electrification clients. And this, we believe, helps make the case for this whole house approach and also for taking into account the multiple benefits rather than focusing narrowly on just one dimension, such as ongoing utility costs, even when those are positive. We spend a significant time in the report talking about the utility cost affordability, though. We understand this is on a lot of people's minds. It's really important, and it can be harder to quantify, especially as rates are changing and the home conditions are changing. In the report, we present two analyses, which we're going to have on the slides here. The first one is focused on how the client experienced the changes on their bills year to year based on what they reported being charged by their utility. And this graphic is just to help conceptualize how different factors impact those charges. So we're making changes to the home condition and the appliance condition. We also know energy usage is impacted by the behavior, how the client uses their appliances, how they're using their home, the occupancy, et cetera, as well as the weather, which would not necessarily be standard year to year in that basic analysis. And then we also have utility rate changes. But when we're trying to understand the client experience, how they felt the program impacted their lives, we think it's really important to highlight this too. So that's the first analysis. The second one, we'll do some standardization. These are the results that we have from that first analysis showing the largely positive impacts of the average annual costs before and after our electrification work for these 4 clients. As you can see here in that third column, for 3 of the 4 clients, the average annual costs change led to savings. In some cases, very significant. In other cases, a little bit smaller. We have clients who are using different amounts of energy here. So that percentage gives a little bit of context as well. The one client where we see the cost increase we'll go into detail on, but we think is an important case because this client had inoperable appliances for our intervention that we came in to do. So when we dive deeper into the data, we actually end up seeing that the heating costs appear to decrease while the base load increased because they were using the appliances for other basic needs that they hadn't been able to do beforehand. And so we think that those nuances are important to appreciate when we're thinking again about how this is experienced household by household. Just leaving this up briefly to make sure folks have the details here, especially anyone who's going to be following the slides afterwards. Again, that second analysis we do is trying to control for some of these variables that may change, which is our way of trying to evaluate the real impacts of the interventions themselves as we try to make the case for how to advance these programs. In this analysis, we do what's called weather normalization, where we adjust the energy usage based on the weather for that bill period. So if it was 10% warmer that bill period than normal, we'd adjust the energy usage by 10% to make a more fair comparison to the other year or month. And then we also used a standard set of utility rates, in our case, the 2025 average BGE rates, to standardize that comparison. So now we're getting closer to isolating for the home condition, appliance condition, though still recognizing that the behavior of the clients may change between them. Here's the same table, but gone through this second analysis process. So in some cases, we see the savings are even more significant. For clients A and D, really encouraging results of annual savings of 17% and 53% in this analysis. This was really significant and encourage folks to look more closely at these cases to see how much this mattered for these clients. For the two clients in the middle here, we have a little bit of nuance that we're going to dive into with more detail in just a second. As mentioned before, client B had those inoperable appliances. So though the cost increased, we'll dive into to the degree to which that actually still was a part of a net benefit for that client and show the data that helps us appreciate that conclusion. For client C, we saw some challenges. This client originally had saved because they had been on a third-party energy supplier that charged them a higher rate than the typical BGE rates before we came to do work in their home. But if we were to compare the standard BGE rates from before to after, we see the cost would have increased. And when we look more closely at the data, we see that happened during a particular season where there were some challenges with how they operated a heat pump. And we can appreciate some learning for how to best support clients so that that doesn't happen. All right, now we'll dive into those case studies. We're skipping over case study A, which again is in the report. Encourage folks to look at. There was a more straightforward case. The ones that we hope will have some important learnings for our attendees are the other three. And here's where Jessica and I will go back and forth with describing a bit about the work. So client B was the case where there was a non-functional appliance, and we see that that contributed to an increase in the baseload energy use post-intervention. When we break out the average utility cost by season, we see that the winter costs were comparable, whereas the cost increased slightly in the shoulder seasons when there wasn't much heating and cooling load. Jessica, you may remember the details of this case with our client who had the plumbing and I believe the dryer issues. Do you want to speak to this one briefly?
Yes. So this home had an inoperable water heater and an inoperable boiler by the time we actually got around to the electrification part of this. And that really, that kind of gave a false look at what the pre was going to be. We did full weatherization in the home. We put in mini splits. We put in a heat pump water heater. And of course, now that the home was fully functional, we're going to see a larger increase in the utility rates and the consumption. And I think her water heater hadn't worked for 2 years at that point in time. So it really was something that we didn't count on seeing before we started, but it's what went into it afterward. And they did get a heat pump water heater along with the heat pumps and the mini split and an induction range and all that goes into that, along with a window replacement and some other rehab type work that helped tighten up the building.
Yeah, thanks, Jessica. And, we think it's important to highlight this because oftentimes folks are coming to programs like GHHIs because there's issues in the home, maybe appliances no longer working, or other significant challenges. And in the bigger picture, that's often when people are looking at making replacements to their appliances, even if they aren't going through a program. And so when we're thinking about the savings that come from that, it may not always be a year-to-year comparison, especially if that baseline is one where the homeowner doesn't have full operation and isn't able to meet their needs the way they'd like. So being able to explain to clients what to expect, but also recognize that programs are meeting other needs besides just high utility costs, we think is really important. And so we appreciate this as a way to analyze and show how that shows up in their utility bills the next years. Client C was the client who had the operational challenge, and we take this as an important lesson on how client education and support as conditions change can be really important for making sure that we maximize the benefits of these interventions. We got a few pictures of this home before the intervention. We had an old gas furnace, an attic with poor air sealing and moisture issues. And I like to highlight the picture on the left, which it shows there's nothing wrong with it. This is just a picture of the homeowner's cat in their living room. As a reminder that, a lot of these homes have significant challenges and needs. uh, they're homes that people are living in, taking good care of, and that these behind the scenes things can really have a negative impact. So we focus a lot on what the challenges were in the home, but like to appreciate that the home itself, that it's the place people are living and they're having full lives. Jessica, you want to take this slide of describing the work that was done in this home?
So yes, the way that the attic had been insulated previously had hidden a pretty significant roof leak. The roof had started to collapse on the back side of the house into an enclosed porch area, and we knew that we needed to get that done. As we started taking down more and more of the roof, we realized it was more damage than anyone thought to begin with. So that was our first step, is getting our funding together to go ahead and do this massive roof replacement for this client. And from there, we were able to do the full weatherization and get, all the health and safety issues taken care of. You know, fix the ceilings that were starting to be damaged on the sides from all the water, make sure that we didn't have any mold going on in the house. And this client did get a forced air heat pump, no mini splits in this house, and the heat pump water heater. She also needed a full panel upgrade, and that was another learning curve for us on the amount of time that it takes to do a full panel upgrade and get the service upgraded here in our area.
Yeah, and so here are some pictures of the results. So cleaned up, air sealed roof and attic with insulation, new heat pump water, and the central air heat pump. And we see with this client that, stabilizing the home, addressing really significant housing and health risks, and then being able to upgrade to a standard where you've got clean air inside with electric appliances that were insulating the attic to help improve the thermal comfort and improving both the health and stability of the home in significant ways. When we looked at the results from the first year when we did our initial analysis, we saw that the costs were declining by a good notable amount, both in the summer season as well as the winter seasons. A little bit more sign of using air conditioning, which is encouraging, which is another positive health and comfort benefit that may add some costs, but be well worth it to the client. But this was pretty encouraging results at first. We know some of these savings came from moving to a third-party energy supplier. We've got that quantified a bit more in the report. But it showed, positive impacts of electrification. These dashed lines marking the highest and lowest bills from the pre-electrification year, showing that afterwards on the right, they were lower. Where the challenges showed up were the year afterwards, which we think is also notable and adds to our case for making sure there's resources for ongoing support for clients is when they face challenges. This next graph here on the left shows the electrification, the second year plus the bit. And on the right shows when the client had solar in recent months. Again, solar is not a part of the general analysis in the report, but we include it for this case study just to show a little bit more detail. These past 2 winters in Baltimore both had historic cold stretches. 2 years ago, we had a long stretch of days with temperatures below freezing. And last year, seen in the solar era, we had a very cold and snowy stretch. We know sometimes that can increase costs, but these costs increased more than expected, which is what we're going to go into with the operational issue we found with how the client was using the heat pump. So the background here, again, 2 years ago, outdoor temperatures were very cold, abnormally so, multiple consecutive days with daily temperatures staying below freezing, even the high temperatures. In this case, we expect energy use to be high, but this was a dramatic increase compared to other winter months when it also had been cold, suggesting there might have been an equipment issue. We saw this in the utility bills, which we were monitoring for this client. Called the client, checked the thermostat, which confirmed it was on the regular heat rather than emergency heat for the heat pump. Also confirmed that the client's keeping up with maintenance, changing the filters recently. So at that point, we called the HVAC contractor that installed the heat pump to visit and found that the client had covered the outdoor component for the heat pump when the snow came that year, intending to protect it. Sorry, there we go. There's the picture. Unfortunately, this forced it into emergency heating mode, which was significantly driving up the cost because air couldn't be exchanged. And we were able to address this, saw that the bills returned to normal right afterwards, but made sure to help the client understand the best way to operate the appliance and make sure we had some support with helping them in the months afterwards. So again, we take that as an example of why the client education is so important. We also worked with this client in the years afterwards. The solar has been really encouraging, and they still find it very positive, the work that was done in their home, stabilizing the home, improving the appliances, improving the comfort, and appreciated the support as they navigated these challenges. Our last case study we'll go through fairly quickly so we can make sure to leave some time both for summarizing our policy recommendations and a Q&A. Client D was the last one, which had the most significant energy savings, up over $1,000 a year. And still in this case, the client most appreciated the health and accessibility benefits of the work that was done in their home. Again, we've got a wave of pictures here. Jessica, you want to explain the situation on the right with the access to the attic?
Yes, the attic access that the client didn't even know existed. It had no access panel, just an old art print kind of covering it. So basically the house was open to the attic, which is, as most weatherization people know, is open to the outside. So they were losing an awful lot of their energy up through this attic in summer and winter.
So very briefly, very positive results here, especially in the winter. Now that the attic was insulated, they had an efficient appliance, and the air wasn't flowing in and out of the attic itself. And when we talked to this client, we organized a home visit to their home within the last year. What they're most appreciative for is all the accessibility and comfort benefits that came with the work. They appreciate the energy cost savings, but the day-to-day that they feel in their home is some of these other improvements. The induction stove that eliminates fire risk that had caused a past injury when they caught themselves on fire while cooking. Handrails improving mobility, especially as they age in place. And heat pump providing new central air conditioning that improves the comfort and helps them feel confident staying in their home through the hot summers. So again, we think this helps bring home our case that just focusing narrowly on one dimension misses what clients are actually experiencing when these programs come into their homes. And taking this holistic approach helps us appreciate the multiple benefits and how we can best target the interventions and best serve our clients' needs. We're going to turn back over to Wynn, and Ruthann may be joining us too to describe the policy recommendations and conclusions we have, and hope to save a few minutes for our Q&A at the end.
Thanks, Justin. So yes, we want to make sure there's time for Q&A. So just I encourage anyone interested in our recommendations to go to the report. I will touch on these and then pass it back to Ruthann for any closing remarks or comments on these. So our policy recommendations coming out of these case studies that we've presented today, we've got three categories here. So one is advancing policies and regulations, both for zero emissions appliances as well as for energy affordability. The second is around securing additional funding to further secure electrification, particularly through this whole house approach. And then finally, supporting organizational infrastructure, the community engagement, the navigation, client support, the data and evaluation that has made these case studies possible. So Justin, go to the next slide. I know Ruthann talked about the zero emission heating equipment standards and clean heat standards and the importance of those. So I won't go into depth. I will just say that I think what we see in these case studies is more evidence that from a holistic perspective, electrification advances household affordability. It's improving health outcomes, it's improving air quality, it's improving quality of life, and in many cases, it's also improving energy bills. And at the same time, energy affordability is so critical right now that it's important to advance further policies and attention on that front. We've got a menu of options talked about in the report, including things like income qualified electricity rate programs, rate cases being heavily scrutinized by the PSC, heat pump rates, different types of rate reform that could further improve energy affordability alongside this transition to electrification. And there are a number of dynamics going on, at the state, the regional, through the PJM market in terms of mission planning that will hopefully be addressing energy affordability in the coming years as well. But obviously, this is critical to address while also addressing, air quality and public health. Go to the next slide. So funding, making electrification and these accessible to all through these whole house and critical repairs. So often homes might be deferred from getting weatherization, from electrification due to some of these other issues, roof leaks, structural issues that we've talked about. So that's where GHHI's whole house approach is so critical. Ruth Ann mentioned the incentives coming through with Maryland's Utility Relief Act, as well as there's have been home energy rebates through the Inflation Reduction Act that were allocated to Maryland, although pending further federal guidance and deployment on those. I hope that these case studies show the benefits from, again, an energy and a health perspective and the importance of this funding. And one other category of funding that I'll mention here has to do with healthcare. And, GHHI has been a leader in securing and proving the value of health funding of interventions into the home. And, looking forward into the future, especially as the evidence builds, we think that there's going to be a stronger and stronger case for, health funding of some of these electrification measures, such as stove electrification, given its impact and benefit on reducing asthma, trips to the hospital, emergency room, et cetera. So that health funding, we hope to continue to build out with further research, but very important as well.
Yeah,
and then oh yeah, go ahead, Ruthann.
No, go ahead. Finish.
Well, just the final slide. I'll be really quick here. So organizational data, infrastructure, and evaluation. So Justin, I think these case studies also show, GHHI providing this client support and engagement, how critical that is for the success of electrification. So in addition to, the funding for the work to be done, just the funding for navigation, case management, et cetera, and for the data evaluation. So we're continuing to build on these case studies with further research, and we'll be sharing that out in future reports. But continuing to evaluate these benefits and quantify them will be really critical in the months and years ahead. So yeah, Ruth Ann, I'll pass to you.
Yeah, and if you go back a slide or two on policy, what we are trying to do here is look holistically on the role of electrification on decarbonization, and all of this in how we improve health, how we improve wealth building, how we improve stability, and improve the ability to have a better quality of life and a better value as we move forward and address our greenhouse gas reduction goals in the state, and certainly meet the challenges that are facing us with extreme heat, extreme cold, and extreme weather. And what we have to be thinking about in this is, for example, our path to electrification isn't just solely about decarbonizing housing. There's 1.3 million Marylanders who sit on electric resistance heating and cooling, and that's expensive and outdated systems that also get improved through this work, and also will lower particulate levels in housing. So bringing all of this together, the Homes and HERA Act, which is looking much more around supporting some of the efforts short of full decarbonization from the current administration, but will help us in our efficiency efforts. But what we are trying to achieve in this work of clean heat is not only clean heat standards in residences, but clean heat standards for industry. And I know we have a question coming in our chat here, but one of the things that communities are faced with, right, and we are thinking about the policy alignment here, is as data centers build And Maryland has not pushed back as hard as some of the other states. So we've faced the challenges on data centers. We have to ensure that the regulation has data centers paying for all of their energy costs, putting guardrails around that, and making sure that we are otherwise making all other buildings more efficient and stronger in the efficiency so that we can lower um, the impact on the grid while we try to also create healthier housing throughout communities. And I think the one angle that we do take more uniquely than most is looking at the role of healthcare in this. We know that if we replace gas stoves, we are going to drive down the incidence of asthma from 24 to 42%. We know that we're gonna cut those benzene emissions in homes that continue to emit even after people turn off their gas stoves. But we know, for example, in California, where they're using an in lieu of regulation under Medicaid, doctors are able to write scripts to improve indoor air quality, to lower asthma directly from the doctor to the contractor, and improving those pathways. But if we do our job well on electrification, we will improve the stability of housing. We saw that in the example of where the family didn't have appliances. We got them appliances that were working, and their overall health, their overall stability, their overall wealth building for their future improved. All of these policies come together in how we make that. But let's get to the questions and answers, and really good job, everyone here. Thank you for spending time on this. So what do we have in Q&A here upcoming? We have a question about the data centers from Carl that I think we've tried to address here, thinking about, the role that Empower is playing. We need to ensure that we're keeping Empower funds in place, that we are using the Utility Relief Act dollars, but we're also holding data centers accountable and aligning all of these policies to lower the impact on the grid, make data centers responsible for their cost, and ensure that they're not overly polluting communities through air and water and land taking. And we have to do both and here, but it is critically important for where people live to improve the indoor air quality, electrification, decarbonization, help us do that greatly. We got a question on application and process for qualification. I assume that means for the Baltimore program. And if you just submit an inquiry to info@ghhi.org, we will make sure someone will be back to you. And if it's about other state programs, we will ensure that we refer you there. But let me see if to the team, has the GHHI team considered home battery storage options for homes undergoing electrification, and what factors are impacting that decision? Go ahead, Justin, on that.
Yeah, happy to speak to this one. This is not something we've done in our programs yet, but definitely something we think has a lot of potential and are keeping an eye on. And I connect this to a lot of the technologies around electrification, whether it's solar, whether it's batteries, whether it's some of the new technologies like window heat pumps that saw. There was also a question about, we think that our case studies show the positive benefits that can come from how we do these interventions today, or how we did them a couple of years ago with the results today. But it's a space that's moving and evolving quickly. And we know there's some things that are challenging right now with electricity prices and data centers taking up a lot of our energy and putting pressure on costs. But we think there's also a lot of opportunities that are coming in quick succession that can change that for the positive too. And taking this holistic approach to electrification, where we're also doing the electrical upgrades and where we're helping educate clients and build up that capacity, we think has a lot of potential to also include homes that are served by these programs in this transition. So Batteries, absolutely a big part of that. We know there's some work that needs to be done on the Maryland regulatory side to value all the benefits batteries can bring and compensate people for putting those batteries in their homes or in their neighborhoods. I think that's really important. But thinking about it from the home perspective, connecting it to all these emerging opportunities that we hope that people aren't left out of. And we think that these comprehensive programs can help set them up for success participating in.
And we got a question here, also, and Jessica may want to weigh in as well, but about working in highly polluted and legacy pollution neighborhoods. And we do that here in Baltimore and in Detroit, where I actually happen to be today. We've done this work in Salt Lake, and we do include in our measures to improve indoor air quality, and especially for some of our more severe asthmatic patients. We are using indoor air purification as well in many of our homes, as well as the heat pump systems that we are putting in. Our goal is to get the highest quality housing for all of our families in that, but we do that, and I'm happy to talk more offline. And there's a question on scale and how many homes you aiming to retrofit. So part of the scale issue, so we are in our total portfolio across all of our work every year, we're into well over 1,000 more homes at various levels of intervention. But what we really need in this is the monies that are not just the heat pumps. When you are installing heat pumps, you also have other structural issues often to address in homes. And we want to make sure that when we are going in those homes that we utilize federal funding for lead paint, we have funding for asthma through healthcare, and we have a lot of the weatherization electrification funding coming from state. We are able to scale this in large part because of we're able to line and braid and coordinate these dollars. Certainly, we're very pleased to see the 21st Century Homes Act or Housing Act, I can't remember which one it is, but that just went into law federally, because they even have a program in that really is structured after GHHI's work to start funding the whole house approach. So they're putting an additional $30 million a year that clearly isn't going to get every home in America. But what we are doing is teaching communities how to do this align, braid, and coordinate better. And when we do that, we are able to effectively scale up from where we are in communities. So the question is on radon. Was radon treated at any of the case study houses? Jessica, can you take that on? And do you know if we treated radon in any of those homes? I know we test for it.
We do test for it in every home, and none of these homes had any radon issues, but we are able to install the radon capture systems when we do come across them.
Great. And related to a previous question, there's an induction stove that has batteries and can run on 120 volt, a little bit more expensive, but would avoid the other cost. We have considered this. I don't think we've yet used battery-powered induction stoves in it when we go in and replace stoves yet. Have we done that yet?
No.
Jessica? So I think we're still analyzing that. A question here from Adam Willis from the Banner. Can you speak to how we expect Maryland's power cuts this past legislative session may impact affordability for households looking to electrify over the next few years? Justin, why don't you start, and I'll play cleanup on that one.
Sounds good. Yeah, so for context, Empower is the statewide energy savings program that operates on 3-year cycles, has rebates available for the utility customers in the state, and also funds the state DHCD to do whole house work in low-income homes, and GHHI uses those funds for that work. This past legislative session, the legislature cut back on the goals for the Empower program for the next 3-year cycle by about 30 to 40% amount. We're waiting to see how those plans come in for the 2027 to 2029 years. But we do have concerns that it will mean that there's less support available for doing electrification work. We appreciate they did not cut back the low-income specific allocation with that, but the folks who are doing this work all in the same networks. The folks who are doing the work for the direct utility rebate programs for non-low-income customers are also working to serve low-income customers. And so cuts to the entirety of the program do trickle down and impact the viability of doing this work for everyone else as well. So we're disappointed that there may be fewer opportunities, but we think there are opportunities for the state to step up in other ways and support electrification. So we hope that they make sure to do that. The other final concern we have with cutting back on Empower is that reducing the energy savings in the state adds to that upward pressure on utility costs for electricity. And we know that we are in a very tight grid region right now. When we take a holistic approach to electrification, we can electrify folks without putting pressure on that grid system. But if we're cutting back on the energy savings that we're doing for the next 3 years statewide, we worry about that adding to some of the grid risks that we know are already pretty intense from this past summer. So we hope that there's other ways that the state can step up and make those investments in energy efficiency that both benefit people in their homes and benefit the whole system itself.
I'm going to take it from there only to also address, I think it's Allison's question about the funding headwinds. You know, part of the solution is the ability to braid these funds together as you look at the scope of work and pull and leverage up funding that is intended to or should be going to housing condition. But clearly, one of the big challenges is what is the landscape moving forward on the federal side. So battling to keep federal dollars like Office of Healthy Housing, dollars coming out of HUD, lead dollars coming out of HUD, continuing to get supports from CDC for asthma programs, and also building the case for healthcare for its investments. We have a national model in our work with WellPoint and MedStar here in Maryland, bringing in funding to help address these issues. But we need all of this together. And one of the things that we are hard at work and fast at work is proving the business case, not only for the whole house model, but looking at each of those components and getting state policy, not only here in Maryland, but across the country, to be able to capture savings and reinvest savings into baseline health of housing as a critical part of affordability. Because we can, if we put our dollars on affordability only on new builds, then we are not really dealing with where 95% of the population is living, and in large part living in housing units that are single up to 4 units or less. We have to build that case around cost savings, around increased wealth building, housing stability, things that save government money, things that provide better opportunity to families. So I think we are always every day looking at the return on investment case and looking at how do we make those cases to each of the individual funding lines, federally, state, philanthropic, and then those quasi public sector, healthcare and utilities and others. So we are working to bring that together, but we need to ramp scale in this country because housing condition with the divide of increasing affordability will be harmed if we don't keep pace in doing that. So other questions that anyone sees that I'm not seeing, please raise and appreciate this. You can reach out to all of us through info@ghhi.org. We have a pretty easy naming on our email addresses, first name, and then first initial, last name @ghhi.org. But we'll get back to you promptly. Please follow us on LinkedIn, on all of the different social media channels. Realizing I need to update that. We thank you for your time today, for your questions. If we didn't get to them, we will email you and get them. We will share the recording, and we will continue to do this series. I want to thank my team for all of the great work. I have to call out Jessica because she and her team are the ones in the houses every day with families, and its policy is great. Doing these valuations are great, but it's the work in the homes for families that we are here to do, and that matters. And we thank everyone listening for your interest. Happy to follow up with you. Cheers. Have a great rest of the week.